For decades, nutrition was treated as background advice in healthcare. Patients were given medication, procedures, and follow-up appointments, while food was often reduced to a short conversation at the end of the consultation. That model is rapidly changing. Around the world, healthcare systems are beginning to recognize that nutrition is not simply a lifestyle choice. It is a powerful clinical tool that can prevent disease, support recovery, and improve long-term health outcomes. The concept of food as medicine, or FIM, represents a fundamental shift in how we think about health. Instead of waiting for illness to develop and then reacting to it, modern healthcare is starting to use nutrition proactively as a targeted intervention. This approach is reshaping clinical practice, medical education, and public health policy. It is also changing how individuals think about their daily meals. Chronic diseases such as obesity, type 2 diabetes, and cardiovascular disease now account for the majority of healthcare spending worldwide. These conditions share a common thread. They are heavily influenced by the daily habits, particularly nutrition. Healthcare leaders are responding by integrating evidence-based lifestyle strategies into routine care. One of the most visible signs of this shift came during the 2023 White House Conference on Hunger, Nutrition, and Health, which emphasized the importance of embedding nutrition programs into healthcare systems. The message was clear. Food is not an optional add-on to treatment. It is a core component of treatment itself. Programs under the food as medicine umbrella focus on improving health outcomes while addressing real-world barriers such as affordability, access to healthy food, and time constraints. This dual focus makes them especially effective for people managing chronic illnesses. The idea of prescribing food may sound unusual at first, yet it is becoming increasingly common in clinical settings. These programs are structured, evidence-based, and tailored to specific health conditions. Medically tailored meals are designed for individuals living with complex chronic conditions such as heart disease, kidney disease, and diabetes. Registered dietitians create meals that meet the exact nutritional needs of the patient's diagnosis. These meals are then delivered directly to the patient, removing the guesswork and reducing the burden of meal planning. This approach allows patients to focus on recovery while ensuring their nutrition plan supports their treatment plan. Medically tailored groceries provide patients with specific food items selected to help manage their condition. These packages often include fresh vegetables, lean proteins, whole grains, and other nutrition-dense foods. The goal is to guide behavior through environment. When the right foods are readily available at home, healthier decisions become easier and more consistent. Produce prescription programs allow healthcare providers to prescribe foods and vegetables in the same way they prescribe medication. Patients can redeem these prescriptions at participating grocery stores or farmers markets. This model has proven especially effective for low-income individuals who face both chronic disease and limited access to nutritious food. It addresses health and social challenges at the same time. In specialized clinical settings such as cardiac rehabilitation, patients often follow structured nutrition plans designed to reduce risk factors. These plans may focus on lowering calorie intake, improving blood sugar control, and reducing unhealthy fats. When implemented consistently, these targeted strategies can significantly improve metabolic health and reduce the likelihood of future complications. The idea that food can function as medicine is not new. Many traditional medical systems recognized this relationship long before modern science began to study it. Today, research is providing a clearer understanding of the biological mechanisms involved. Many foods contain naturally occurring compounds that influence the body at a cellular level. These substances include flavonoids, organic acids, terpenoids, and polyphenols. These compounds have been shown to reduce inflammation, protect cells from oxidative stress, and support immune function. In practical terms, this means that the food you eat can influence how your body responds to disease. For example, berries contain antioxidants that support cardiovascular health. Leafy greens provide nutrients that regulate blood pressure, and fatty fish supply omega-3 acids that reduce inflammation. These effects are not theoretical. They are measurable and clinically relevant. Now, let's take a look at the ways food and medicine are working together. Certain foods have dual roles as both nutrition and therapy. This concept is often referred to as medicine and food homology, which recognizes that some natural substances can support healing through multiple biological pathways. A few examples include, but are not limited to, ginseng, which supports energy metabolism and cognitive function, chrysanthemum, traditionally used to support immune health, and saffron, which has been studied for mood and neurological support. Even common foods can be optimized for medical use. Sugarcane molasses, for instance, contain iron along with nutrients that improve iron absorption. This makes it a practical dietary option for individuals managing iron deficiency anemia. One of the most surprising developments in modern healthcare is the rise of culinary medicine programs in medical education. Historically, many doctors received minimal training in nutrition. As a result, they often felt unprepared or reluctant to guide patients on dietary changes. Medical schools are now addressing this gap through hands-on cooking and nutrition courses that teach practical skills alongside clinical knowledge. These programs focus on translating nutrition science into real meals, teaching portion control and meal planning, as well as helping future doctors communicate realistic dietary strategies. Culinary medicine also encourages collaboration between healthcare professionals, chefs, and dietitians. This team-based approach reflects the reality that effective healthcare requires multiple forms of expertise. So, what are the real-world benefits of looking at food as medicine? The impact of food as medicine programs extends far beyond individual patients. They are producing measurable improvements across healthcare systems. Participants in food as medicine programs often experience improved blood sugar control, lower blood pressure, reduced hospital admissions, plus better medication adherence. These changes translate into longer, healthier lives. Preventing disease is almost always less expensive than treating it. By addressing nutrition early, healthcare systems can reduce the need for emergency care, hospital stays, and long-term medication, translating into less strain on the medical system in general. This economic benefit is one of the main reasons governments and insurers are investing in food as medicine initiatives. Access to nutritious food remains a major challenge for many families. Food as medicine programs help bridge this gap by providing consistent access to healthy meals and groceries. This creates a ripple effect that improves both health and quality of life. Now, this is great news if you're chronically sick or currently in need of medical care. But what does this mean for you and me in our everyday lives? The biggest advantage you have if you're currently healthy is that you do not need a prescription program to start applying the principles of food as medicine. The core idea is simple. Your daily food choices shape your long-term health. Small, consistent habits often produce the most meaningful results. You literally only need to do the following few things to get immense benefits. These consistent habits are things like increasing daily fiber intake, prioritizing protein at meals, choosing minimally processed foods, maintaining consistent meal timing, and tracking intake to build awareness. These actions may seem basic, yet they form the foundation of sustainable health. And if you find content like this helpful and want more practical guidance on nutrition and health, take a moment to like the video, subscribe to the channel, and hit the bell icon so you never miss future updates. Healthcare is moving toward a model that emphasizes prevention rather than reaction. Food is becoming one of the most powerful tools in this transition. The shift does not eliminate the need for medication or medical treatment. Instead, it strengthens these interventions by addressing the root cause of disease. The message is becoming increasingly clear across research, clinical practice, and public policy. Food is not just fuel, It is information, it is therapy, it is medicine. Learning about nutrition is valuable. Applying it consistently is what creates change. That is exactly why structured guidance makes such a difference. If you are ready to simplify your nutrition and build habits that actually stick, you can start today with a completely risk-free opportunity. I'm offering a 14-day free trial to my coaching service. By joining Better Balance Coaching, you'll receive immediate access to personalized calorie and macro targets, exercise programs that can adapt to your needs on the fly, weekly check-ins, and expert feedback, simple, realistic nutrition strategies, plus ongoing accountability and support, tailored to fit your life. You shouldn't have to make your life fit some generic exercise nutrition plan. Instead, your exercise nutrition plan should fit your current circumstance and adapt as your life changes. That's what Better Balance Coaching is set up to do. Plus, as an additional bonus, you will also receive the Nutrition Shortcut Bundle completely free when you sign up for the 14-day trial. This bundle includes 12 science-backed booklets that teach you exactly how to implement the nutrition plan based on your goals, get results, and maintain them long-term. No guesswork, no complicated rules, no extreme diets. You can check out the offer in the link in the description below or scan the QR code that's on screen right now. Hope you found this information helpful, and I'll see you in the next video.